Well, thank you all for joining. And we're really happy to have you as part of this. Kristin and I are very excited to share with you the information that we've been gathering around what's happening in the home and the movements that are happening in the overall health and healthcare space. As you'll hear, what we've really done is look at a portion of the population that's really critical in the healthcare world. These are adults in the US that are between 60 and 79. And we're going to share with you what their perception is about their health, what their perception is about technology, and how essentially home is becoming the focal point of healthcare moving forward. But before that, I just wanted to share with you that what you're going to hear is potentially 3 myths that we're going to be challenging in the data that we'll share with you. Now, the first myth is that these people are old. And what they tell us in this, that they're not old. We're not old. And the second one is that, you know, we have this myth that this cohort is technology laggard. And what we found, in fact, that they're not technology laggards. And so that's a second myth that we're going to be challenging. And then the third one is sort of related to that, is that they're afraid to sort of be tracked or be monitored. And again, we want to challenge that as well. They're not afraid to be tracked and monitored. In fact, many of them, as you'll see, want to feel safe moving forward in that world. Okay, so this is, we just wanted to set that stage right up front. But why is this cohort so important, and why is it so important for us to really look into their technology adoption and their desires and their needs? By the end of this decade, there's going to be 93 million Americans that are going to be ages 60 or above. That is just over 1 out of every 4 American in that age. So a quarter of the population is going to be in this age range. And today, that's like putting every single person that lives in California, Texas, and Florida in one area. That's how many people are going to be in this. So it's a really large population, and that means that we have to be ready for them. According to the AARP, practically 3 out of 4 of adults that are over 50 years of age want to stay in their home long term. And that number's been consistent for well over a decade. This is not a pandemic effect. This is something that is, you know, has been part of the desire of this population to want to stay at home as long as they can and be healthy as long as they can. So it's important. But there's also a significant financial and economic impact to this. $265 billion of this market is going to shift to the home by 2025, according to McKinsey. That's a large market. And so, you know, it's not an economy that we can ignore, really. So really, large population, a great desire to want to stay at home, and with large economic impact here. And what's really also important to think about is this is a time period, between 60 and 79, where lots and lots of life change happens. And so we wanted to understand what that looks like. So what did we do? We took a multimodal approach. We did a qualitative immersion with 15 adults in that same age range, where we did in-depth interviews with them. And then we did a quantitative survey of 1,000 adults in that same age range from across the United States. And that's the information that we're going to be sharing today. So just to let you know, we made sure that we are representing the US Census data. So all of the major regions in the United States are represented here with approximately the same percentage of populations as the US Census, the gender balance between our respondents, and then the communities where they live all represent the US Census. So we want to make sure that what you're seeing and what we're reporting on is representative of the United States as a whole.
Good, thanks, Hamid. So let's get started. And before I start, if you have any questions, please feel free to put those in the Q&A section of this webinar, and Hamid will see them and we'll address them as we go through, or we'll do it afterwards. So, but what we're going to do today, so we've set up sort of the opportunity. And what we wanted to do as innovators is really understand, okay, what are those building blocks? What do we need to know as innovators to help be able to enable our older adults to be able to stay at home? And there's going to be 4 things that we talk about, but the first thing that we cover is their foundational health and beliefs and behaviors. So what's their baseline? What are they thinking about? And then we'll move into what it means to be independent and stay at home, how health tech really plays a role. And then finally, what does that health access and who do they actually trust to be able to deliver that care at home? Okay, so do you think they're healthy? They think they're very healthy. So 81% are very or somewhat health conscious. You can see here that they're really optimistic about their health. They feel like they're doing things that, to make sure that they're staying on track and they're being healthy, and we can talk about some of those activities. Even those that do require some medical care, 46% of them have a serious or chronic health condition or a health-related disability that requires frequent medical care. And that actually is on track. It matches sort of the general population. So for this population, 60 to 79, almost half have some sort of chronic disease or health condition. But they're really optimistic about their health in the future. And if you look at that, 45% are somewhat optimistic and 23% are very optimistic. Even those with chronic or other serious health conditions are also optimistic. There's a little bit of difference if we look at, for those that don't have a chronic or acute health condition, 78% are very or somewhat optimistic. And those that do have a chronic health condition are almost over half optimistic. So still a lot of positive attitudes, and that really enables healthy behavior, and we think enables the ability to make changes in your life as well.
It's really important to really ground truth that mindset about health, because people act the part. And so, we want to signal to them as we're moving forward that they are that, optimist, that we're leveraging that optimism moving forward.
And so we wanted to know, so what are they thinking about? What is their main priority for health in 2022? And, our team, we were really surprised. We thought we would hear more about chronic conditions, but instead, the number one thing and the number one priority for our 60 to 79-year-olds in 22 is weight. So for all of those companies like Noom, like all of the, WW, everybody that's really out there developing health and weight technology and helping people stay healthy via weight, that is actually what this group is thinking about. Last year and the year before, we did another generational study where we looked at Gen Z, and we asked Gen Z what they cared about. The number one thing for them was sleep, then exercise, and then same as our 60 to 79-year-olds, sort of diet, nutrition, and vitamins and nutritional supplements. So just comparing different age groups in terms of what their health priorities are. We heard a lot about, that health is both mental and physical, and this age group is really comfortable talking about their mental health. In fact, even more comfortable than Gen Z. We heard one of the women that we spoke with via Zoom earlier was that, she said, good health is good mental and physical health. It's important to be physical every day, which is why I work out and make sure to get my heart rate high enough. We heard a lot of people that, now that they're retired, they're making sure that they're focusing on their health, whether it be getting out for a walk or even, doing stretching, or even if they're lucky enough, playing golf. Okay, so that's the baseline. So we've talked a lot about their positive attitude, their belief about staying healthy and being active. And so now let's talk a little bit about, how they want to maintain their independence and stay at home. So in our survey, 2/3 of the population want to stay in their current home, even if they can no longer properly take care of themselves or have to be dependent on others. So there's a real openness and desire to do everything that they can to be able to stay at home, regardless of their condition. We even heard one of the women that we spoke with was, her purpose is to be independent, take care of herself, and stand on her own 2 feet. The day that she said she became dependent, she wants to find a way to say goodbye. So they are serious about independence. And as innovators and those that are in the health industry, the more that we can do to help sort of enable them to be independent at home, I think the better that we can be as an industry. So let's break it down a little bit and start and talk a little bit about the statistics. So of those 67% that want to stay in their current home, 24% say that they want to stay in their current home, even if they can't properly take care of themselves as they age. 43% of those said that they want to stay in their home, even if they have to be dependent on others for assistance to help take care of myself. So there's an opportunity here to deliver that assistance. And what you'll find as we go through the data is that they're not getting any now. So do they want to be tracked? And, one of the women that we spoke with said, when I reach an older age, I'd like my children to have a camera to monitor my movement. Would it expose me to thieves? Maybe, but I would prefer that to being completely isolated. So, one of the things when we talk to experts about this study and in the industry and said, what do you want to know? And a lot of them said, what about data privacy? What about their willingness to be tracked? And here's what we found. So 63% would be comfortable with someone monitoring them if they helped them stay at home longer. And 48% did worry about the security of their information when it came to technology. So this is a myth that Hamid set up in the beginning that we're busting. So we suspected that people would say, no way, I don't want to be tracked. I don't want people to be tracking me in my home. But in fact, like over half are saying, yeah, if it's going to help me maintain my independence, I'd be willing to stay at home.
So Kristin, we're not giving a pass to anybody here to be lax about data privacy and making sure that that's going to be, any issue that's compromised, right? I mean,
right. No, this is not a pass. This is just a willingness.
Right,
and
exactly.
Exactly. As Gen X with parents that are, in that generation, and none of us want that for our parents, but do we want to be able to help them stay at home? Absolutely.
Right. Yeah, I think why this is really important, as you're mentioning, is that it's not really going to be as big of a barrier to adoption of technologies as long as the data privacy issues are well covered. There's not like an emotional fear around it that's going to keep adoption of new technologies and moving that forward.
Exactly. And when they're purchasing technology, what we wanted to know was, are they thinking about health and wellness? And the answer is yes. 37% think about how technology can help me manage my health and wellness when they're purchasing new technology. And 53% think that technology will play a major or moderate role in helping them age in place. So that's a big number and one that we can really influence and help out with. But here's the reality and the opportunity. 67% haven't made any purchases to change their home environment to better support them as they age. So we have a group of 60 to 79-year-olds who are like, yes, we absolutely think that, technology is going to help us age in place, but we haven't done anything about it. So that's it's over 2/3 of people in this age group that are, either procrastinating or waiting, or they're just, a lot of people we spoke with, they said to us, I haven't even thought about this. Mm-hmm. And this was all the way from our 65-year-olds to the 78-year-olds that we spoke with. They're not, for those that are really well, they're not actually thinking about having to do something at this point.
Yeah. I keep thinking about that $256 billion number. and multiplying that by 67%, that's the opportunity in this, in this world and in this market.
Exactly. And so why haven't they done anything about it? And, we could hypothesize lots of different answers. We could think, it's because, and we'll share some innovation territories that can really be used as a foundation for innovation for this population. But one of the things that we wanted to point out and we wanted to understand, so what concerns do you have about technology is the question that we asked. And over half of them said that the user experience is not friendly and feels overly complex. So when we talk about assumptions about this age group, yeah, we're absolutely right. User experience is an issue and there's an opportunity to improve it. There's an opportunity to feel better about it and make it less complex, make it a lot easier. Some say that it's expensive to purchase. And then we already shared this number, this 48%, because we don't want to give you a license to just go ahead and track with no limits. They do worry about the security of their data and information. So,
Kristin, someone's actually asking a really salient question in this, in the Q&A. They say, it's fascinating. As a single woman who turns 60 this year, I think about this a lot. How do I balance my independence and privacy against my safety? And I think that's really the key, is that what we're learning is that they are anticipating to have control over that technology. And I think by giving them that control is how each individual can balance that. But as a whole, it's not really something that's holding this cohort back from adopting technology. Right.
And so are they getting assistance? That was another question that we wanted to know. And, if you are getting assistance, what kind of help are you getting? And the answer is the majority of those that we surveyed are not receiving any sort of assistance with daily activities. So 20% for home upkeep, almost 20% for transportation, but really right now, there's not a lot in this population that is receiving assistance. But almost half don't think that they're not going to need assistance in 3 to 5 years either. So there's this really optimistic and positive view of how they're going to age in the future, and that they're actually not going to need any help. And who would they want to get help from? So their spouse or their partner or their children. And I want to point out this 20% that said that they feel the most comfortable relying on their healthcare team for assistance. And of those who selected their healthcare team, 59% of them had a chronic health condition. So, for that large population of 60 to 79-year-olds that do have a chronic health condition, the healthcare team is going to play a really big role in helping them age in place and keep health as, home as the center of their healthcare routine. Women seem to be more comfortable relying on others for assistance. If you look at, the female versus male numbers, 43% would prefer relying on their children in the future, 16% relying on their grandchildren, and then 50% want to stay in their home, even if they have to depend on others for assistance. So there's a difference between our females that want to, that are of this age, as well as our males. And, a lot of when we were sort of setting up this study and asking for opinions on things that, people wanted to know about, one was loneliness, right? It's one of the biggest factors of the social determinants of health. And we looked at lots of questions around loneliness. Do we feel lonely? Do we have social connections? And I think one of the things here that sort of rose to the top in our survey was that, maintaining health at home, it does require social connection. And if you look at that number two, 38% just wanted a phone call to see how they're doing. And we heard this in our qualitative interviews as well, is that even if it was just a peer, someone we didn't know, just call me and see how I'm doing. I don't want to text, I don't want a video, I just want a simple phone call to say, how's everything going today? How are you doing? Okay.
Go ahead, 1 out of every 4 of our respondents currently lives alone. And so that's, something to keep in mind, as well as I believe the number was 53% of them felt somewhat isolated. And
Yeah.
so there you go. So I think it's a really important social determinant, but also just a simple phone call. That's a really low tech solution to such a big problem.
Yeah, and 57% of those in our survey said that they do have a level of concern in maintaining social connections. And we know that there's companies in this space that are innovating and trying to be, as Papa is, that family on demand. So companies like Papa and friends and family and ways that we can sort of keep everyone connected will really help them remain vibrant, remain happy and healthy at home as well. Okay, so we've talked a lot about independence. So now let's talk about the integration of health tech at home. So what's happening? How is it happening? And what are the opportunities? Hamid, do you want to?
I do. So this is a classic technology adoption curve, and it was also popularized by Jeffrey Moore in the 90s around crossing the chasm. Around this problem of adoption that happens. But we typically wanted to use this, and we typically use this to really identify whether a particular market shifts or skews one side or the other from this natural bell curve. And so, any market by definition should be on this bell curve, but you can see here that our data didn't really show that they skewed much more toward laggards. I mean, this is a group that's pro-innovation, pro-technology adoption, just like any other market. And so we have no reason to believe that their skepticism around technology or any kind of an inertia to adopt new technologies. And that was a big myth that we wanted to bust, actually. And so we're really happy to see that the data really support this strongly.
Yeah, and you can see here, one of the men from our study that we spoke with in Qual said, as time goes on, if we have medical issues that could be problematic, we would want to supplement with some devices. So there's an openness to, remote patient monitoring or whatever it might be to be able to help, again, this idea of independence at home come to fruition. So what does health tech do, and why are people buying it, specifically in this population? And 63% said that they purchased it to make my life easier. And then almost 50% said to improve my health condition. And of those who selected that to improve my health condition, 51% of them have a chronic condition. So there's a big opportunity for health tech to really, and sort of fulfill. I know there's a lot of investment and there's a lot of companies that are trying to solve this right now, but knowing that this is more data to really support that. We see also 1 out of 3 said to be more connected. So reasons for purchasing health technology. And so what have they purchased? So of those that have made purchases with health in mind, this is going to be no surprise, but it's just confirming that there is a big opportunity in voice. So 37% had some sort of voice assistance that they purchased to help them transition to be more independent and healthy at home. Of course, there's physical devices like grab bars and safety rails. And then 13% of those who made purchases with health in mind or security devices, smart doorbells, or even cameras. Okay, but the reality is that most haven't done anything yet. Okay, so there's this opportunity where 67% are thinking that it's going to help them, be independent at home, and yet they're not doing anything about it. You can see here, this is just another way to look at the data. Voice assistants, fitness trackers, smart watches, those are the things that they're buying today to maintain and be healthy at home. Okay, so what else? And so from a health technologies that are really the most useful when it comes to monitoring an existing condition, 38% are choosing that. 35% are actually saying that it's helped me make changes to my current health routine. And then 31% are saying that it helped me learn more about my body. So we really think that there's an education opportunity here for a lot of our health tech companies to realize, and that's one in education. So if we're giving them, and this sort of matches one of the trends and the forces that we saw in the beginning of the year, which is that consumers are wanting more direction with their data. So don't just give me data for the sake of data, guide me, help me do something with this so that I can make changes to my current health routine. All right. So all of our doctors that are listening in and will listen in afterwards, I know everyone's wanting to know, okay, so where do we fit in? Where do the experts fit in? And we'll tell you a little bit about this. And good news from that perspective, HCPs are still the trusted source for managing their health. So, if we look at our trust numbers, I trust myself more than my doctor to manage my health and wellness. Not even 1 out of 3 are strongly agreeing to that. So 42% are strongly or somewhat disagreeing. So our doctor consumers that we see a lot in younger generations, this group still wants their doctor to be involved or their healthcare team. So that's really important too, as we figure out ways to sort of maintain that independence at home. That connection to our HCP is really, really important. And how do they want to access their care? It is traditional. 40% of them want to be able to visit their healthcare provider's office. And if they had a backup choice, you can see that it slowly trails down to visiting a pharmacy or medical care inside of a retail store. If you look at in the last 6 months, the way that they're accessing care outside of a traditional doctor's office is that 38% visited a pharmacy or medical care inside of a retail store. 1 out of 5 use telehealth or telemedicine. So an opportunity exists and is being realized by the Walgreens and the CVS's and the Rite Aids of the world to be able to have that pharmacist deliver sort of in the moment care if it's not something that they can achieve at a doctor's office, or if they can't get in to see their doctor, they are going to go to the neighborhood store and ask the pharmacist what to do. So, even though our HCPs are really playing a critical role in choosing technologies, of course, like most of them are turning to Dr. Google and then to their children. So 1 out of 3 are looking to their children. This is a number that we actually thought would be higher. Of course, we have our own bias going on as Gen X, but they're not turning to their kids as much as we thought they would. So they are looking to their healthcare team. And of course, they are looking at Dr. Google to recommend health technologies. We also wanted to know, and we've asked this population as well as Gen Z, how comfortable are you using technology to self-diagnose? And the answer is that, 20% feel comfortable diagnosing and treating themselves, but 46% are comfortable, but they also want to consult a healthcare professional. So for those of you that are developing technology or devices or remote patient monitoring options, we also want to be able to connect them with a healthcare provider, whether that be virtually, whether that be a text, or even just a simple phone call, so that they can have some confidence in, if they get their data, what do I actually do about it now? Okay. We also wanted to know about brands and who they trust, and trust is really traditional. One of the women, and this really echoed a lot of statements from those that we spoke with, said, I would only trust Mayo Clinic. So out of a list of brands that we provided in the quantitative survey, the ones that they trusted the most with their health data were the most traditional organizations. So from the Mayo Clinic to the CDC, to the FDA, to other large healthcare institutions, those were considered the most trustworthy. Those that were considered untrustworthy were some of the newer, or in the last 5 years, entrants into the healthcare space, like Whole Foods or Google or Apple or even Peloton. Best Buy as well. They're considered untrustworthy by this 60 to 79-year-old group. I do want to say that there was a little difference in the data for 60 to 64-year-olds. There is more opportunity to trust for the more sort of Lululemons of the world, the sort of the Whole Foods, the Apples, they do have a little bit more trust than those that are in the older end of our age group. So what do we do? How do we prepare for the future of home as the center of health, and that home is the center of health? So what do we do as innovators? How can we, do something about it? And so what we've done is we've built 3 insight-driven innovation territories that can help you really move forward with whatever ideas you're thinking about, or if you're in the final stages of implementing something. 3 different ways and opportunity areas that we'd like to explore. And one is procrastinate and pivot, and we'll talk more about all of these in a minute. Invisible and integrated, as well as haptic and vibrant. So the first one, procrastinate and pivot. So you all remember us talking about how a lot of them aren't doing anything about making changes in their home. And so this is really about those that are older, 70 plus, who might suffer an immediate setback in their health and will do whatever it takes to stay at home. Those companies and those brands that are already inside their house will most likely win in this space. So for Alexas, the Best Buys, the Rings, those technologies that are already there will have the most opportunity with this group. There's more than 80% of them are not using assistance of any kind. So they're procrastinating right now, and then they're gonna have to pivot quickly. So really easy opportunity to be able to help this group remain independent and stay at home. The second one is really focused on our chronic care sufferers, or those with chronic diseases. So this idea of being invisible and integrated. So this is a foundational innovation territory for those that have been diagnosed with a chronic condition. They might own a 1st-generation fitness tracker or smartwatch. What really matters to them is their independence, and they don't want to have to be thinking about their chronic condition every single day. They would love assistance in terms of being able to make it invisible, help me optimize my health in being open to a device. They might have a 1st-generation device right now, but they're really looking for, and could be looking for, an innovation to help even make it more proactive and invisible in their lives. And then finally, a big opportunity for those that are, considered early adopters. So this territory is all about haptic and vibrant. These are the people that are, closing their rings, they're playing pickleball, they're meeting up with their friends, they are living life, and they're retired, and they're looking for technology to support them, not only be healthy, but also stay connected. This is really important as we think about the loneliness factor and maintaining social connections. And then knowing that this group is really interested in using technology to gain an edge on their health. Some brands to watch here, of course, from a neighborhood perspective, the Rite Aids, the Walgreens, the CVSs of the world, where they're able to sort of deliver that haptic care, that blended experience of online and offline. And then there's other brands like Strava, who might not even be doing anything in this space yet. However, with the ability to focus on fitness and do it both online as well as in person, that we think that Strava is a brand to watch in this space to be able to help older adults remain independent, stay connected, and have a really vibrant life. And then, of course, Apple, with the integration of Apple Watch and everything that Apple is doing from the technology advancements in health at home. So those 3 territories are really ones that can be used as the foundation for innovation. We see the integration of our healthcare professionals really important, and in every single one of these territories, there's a role to play for innovation from a healthcare perspective, delivering care, staying connected, and most importantly, helping our 60 to 79-year-olds remain vibrant and age in place. We'll open it up to questions, any formal questions. We saw a couple come through, but I don't know if anyone else has anything. Just want to thank our team too. Alexis Fring and Corey Lark did so much to help get this, get all the data and do the analysis and the interviews. So thank you, team, for making this amazing.